Hi, I'm Dr. Dean St. Mart, formulator for supplement needs, and in this video we're going to talk about liposomal curcumin and resveratrol. So to start, what is curcumin? Curcumin, or more specifically curcuminoids, are the active constituent of the spice plant turmeric. So when we use turmeric for cooking, we're potentially getting some of the benefits of curcumin and the curcuminoids. Now these have a vast positive benefit to our body when we look at what's been studied in the literature. More specifically, it helps to lower inflammation. So again, it may be a positive supplement to use if you suffer with joint inflammation or even inflammation caused from certain disease processes. Within the liposomal curcumin and resveratrol, we've used 200 milligrams of 3-peak curcumin. So let's next speak about resveratrol and what resveratrol is. Resveratrol is a component of grapes. It's an antioxidant which grapes produce to combat oxidants that could destroy the plant. So you can call it an antioxidant. But resveratrol has very low bioavailability in humans. So what we want to do is increase its bioavailability, which in simple terms is a way of increasing the percentage of the compound which remains in the body unmetabolized. When we look at the positive benefits of resveratrol, it can have cardioprotective effects, so it protects us against cardiovascular disease risk. It helps to decrease insulin resistance. There's even some papers that show very high doses of resveratrol can even lower aromatase, which converts testosterone to estrogen. And that can be very useful for male athletes to increase testosterone. It also has a synergism with curcumin to help, again, lower inflammation and potentially have anti-cancer benefits. So because both curcumin and resveratrol have very poor bioavailability, what we've done is we've used a technology known as liposomes. These are nanoparticles that are derived from a phosphatidylcholine complex. So basically, they're fatty molecules that are nano-sized, so that it can actually penetrate into our cells. The outside of our cells have a phospholipid membrane, so it's a fatty membrane. So these molecules are able to penetrate through our cells, get lysed, which again means that we burst them open, and that delivers the contents of the liposome. So therefore, we're delivering curcuminoids and resveratrol directly to our cells, which again is going to have vast superiority to oral ingestion of those two supplements. Now, again, when we look at curcumin taken orally, it's subject to hydrolysis in the stomach. And that's why other companies may choose to use bioperine, which is a black pepper extract, to improve the bioavailability of ingested curcumin. We've gone one step further and actually used a more bioavailable delivery method. Now, what are we ultimately looking to control when we use these two supplements? If you look at your blood work, your hsCRP, which is your high sensitivity C-reactive protein, that's a marker for cytokines, which are inflammatory signaling molecules. So our body makes these cytokines. If we make a flood of them in response to an infection or an injury, our liver processes these cytokines and creates C-reactive protein, which then goes to the site of inflammation to try and clean it up. So if we have high levels of CRP in our blood test, we know that there is high inflammation in the body. Liposomal curcumin and resveratrol is specifically designed to help offset that CRP production and lower total inflammation in the body. So hopefully that gives you a little understanding and appreciation towards our liposomal delivery method and why we've chosen it specifically for curcumin and resveratrol. I've covered also about liposomal technology for our glutathione and CoQ10 if you want to check out those videos. I'm Dr. Dean St. Mart, formulator for supplement needs, and thank you all for listening.